like I said, we're still in the midst of this pandemic. And one of the things that's important to me, not only as a physician, but, as a mom with kids in school, is that we are able to keep all Californians healthy and safe, that we're able to keep our schools open and our businesses thriving. And so there are a group of us that people affectionately call the Vax Caucus or the Vaccine Caucus.
Oh, really?
Yeah. And so with us, we have introduced 8 bills so far dealing with vaccines or around COVID in general. And so the bill that I am pushing out from that caucus is AB 1797, which deals with updating the California immunization registry. And what this would do is, one, give schools the ability to have, access to the immunization registry, the California immunization registry. They do have limited access at this point, but can really only report on those vaccines that are required. And so, it's hard right now for them to say who's been vaccinated with COVID vaccine or not, because that's not a required vaccine at this point. And it also requires physicians that give out vaccines to make sure that they're putting this information into the vaccine registry. And then the other thing the bill does, which is very important, is that as you're putting the information into the vaccine registry, you also input their race and ethnicity unless the particular patient or parent opts out. And the reason why this is so important is because we know about health disparities. We know about issues as far as who's getting immunizations and who is not. And so this is actual data to prove that there are some disparities there or there aren't. And if there are disparities, then we can focus our efforts and resources on those communities to help make sure that we're getting the information to them, and that we're also providing access for those communities to become vaccinated. So that's a big priority for me.
You were talking about how you were in this, what do you guys call the Vaccine Caucus? Is that what you guys call yourself?
That's what we're kind of known as. It's and we got together, we started this actually during the summer recess last year, because we kind of saw that there may be an uptick in COVID around wintertime. But it's myself, Assemblymember Lowe, Assemblymember Wicks, Senator Pan, Senator Newman, and Senator Weiner. And we've been working on these bills.
And kind of, I guess, is it surprising to you seeing this kind of vaccine hesitancy and, a lot of discussion about kids and vaccines and, it kind of bewildering to me and a lot of people, but it seems to be a major issue. And kind of, what do you guys expect? And, how do you deal with this?
Yeah, well, it's definitely unfortunate. It's, I think that over time, there has just been a growing number of people who are just against vaccines in general. But with this particular virus and this particular vaccine, it was so politicized. And I, in my lifetime, do not remember anything like this being politicized, whether it was the flu or Ebola somewhere else. Like, I don't remember, it's science is science. And so I think because it was so politicized, that's why we're seeing what we're seeing today. I mean, and I was talking to a friend earlier because I was looking at like vaccination rates from different states. And, you can see the difference, unfortunately, in what are considered, quote, blue states and what are considered, quote, red states in terms of the percent of their population that it's vaccinated. So that's why we're seeing it this time. I mean, I think that it's natural to be concerned about something new. I admit, when I got the vaccine, I was like, oh my goodness, because I was practicing at the time, I was doing surgeries. And so the first week that it came out, I had to get it. Right. And I was like, oh my God. But now we've had so many people that have gotten the vaccine that, there have been more people that have gotten it than we've had in any previous study or trial or anything before anything came out, that a lot of the concern or the rhetoric is completely unfounded. There was a mother at my son's school and said, oh, I'm not going to have my daughter get the vaccine because I want her to have children in the future. I was like, what? Wait, huh? You know, right. So because now there's this thought that it's going to cause infertility. So it's unfortunate. It's unfortunate because it is a virus that is so very contagious. And for those who are not vaccinated, it is potentially so very deadly. And, you know, it's also a virus that you don't know once you get it, what that long haul syndrome is going to be for you. Mm-hmm. And, you know, I have, my dad is from Louisiana. I went to college in Louisiana, and I have family in Louisiana that think a little different than I do. And I spoke with one of my cousins a few weeks ago and found out that he had just gotten out of the hospital because he's not vaccinated, and he had been in with COVID for 22 days, in the ICU 18 of those days. ICU 18 of those days, because he believed that the vaccine had killed someone. So it is unfortunate that it's been so politicized, because it allows for all this misinformation and disinformation to get out there and just run rampant in our communities.
Right. Make sure you click the button below and subscribe, and hit that notification bell so you can keep up with all our news and updates.